Hope your work week is off to a good start. You're watching Arirang TV's special coverage of COVID-19. I'm Min San-hee. In response to recent infection numbers, authorities have announced intentions to toughen restrictions on some facilities and activities here in the metropolitan region starting from tomorrow. Now, that would be the 1st of December. We have details on these intentions later on the program. Here first is Kwon So with the latest on the pandemic. Now, so I hear Korea has recorded more than 400 cases on this Monday.
Yes, Sunny, for the past 2 days, Korea has been seeing figures above 400. 438 is what we're seeing this Monday, with 414 of those being local transmissions. And out of these local transmissions, over 260 were reported in the metropolitan region and also over 150 elsewhere. Now, although cases did drop to below 400 on Sunday and Monday after we had 3 straight days in the 500s, we have to remember that we have a lower number of tests conducted over the weekend. And with that, we have a total of 34,201 infections here in the country, a death toll at 526, and also, the number of people who are in quarantine for the virus has surpassed 6,000 now. Now, with these daily numbers rising at this level, health authorities have been considering whether or not to impose tougher social distancing measures. And what was decided over the weekend was that level 2 measures will remain in effect in the metropolitan region, and elsewhere in the nation, level 1.5 will start from December 1st if they haven't already implemented those or higher levels independently. In the greater Seoul area, in addition to the level 2 social distancing, extra measures will kick in, including the banning of specific facilities such as saunas and indoor sports venues or classes. Also, accommodations such as hotels and guest houses will be prohibited from hosting year-end events or parties. And on the question of why then the social distancing measures were not raised to level 2.5 in and around the capital, Prime Minister Chung Se-kyun said this.
Rather than adjusting the level uniformly, we are working to minimize disruptions to people's daily lives through precise, targeted preventive measures.
Right, I see. On the international front, Soa, let's start with concerns in the U.S. following this past Thanksgiving weekend.
Yes, Sunny, as millions of people have been traveling back home following the Thanksgiving holiday, the country's top infectious disease expert Anthony Fauci warned of a, quote, surge upon surge of COVID-19 cases in the coming weeks. And on Sunday, the country recorded a record high of 93,000 hospitalizations. Now, the U.S. has been reporting over 100,000 daily cases for almost a month now, standing at 13.7 when it comes to the total, 13.7 million, of course, in total accumulated cases. Now, France, with some 2.2 million infections, is relaxing lockdowns on the back of dropping numbers. We will have more on that later in our program. Meanwhile, Poland has surpassed Peru over the weekend in total cases, and Turkey has become the country with the 18th highest number of infections, seeing death tolls rising throughout the past week. And with that, the total number around the world stands at 63 million. We also have over 1.4 million fatalities. And those are the updates I have for now. I'll have more after the government briefing. Back to you, Sunny.
All right, so thank you for now. Meanwhile, seeking to stay safe and sane amid the prolonged pandemic is proving to be an increasingly tough task. But efforts are in the works to provide support, that is, to this end, and we have details up next.
Hi, it's Shin Se-byuk. As the pandemic prolongs, a new term called Corona Blue has been coined. It literally refers to depression and anxiety caused by COVID-19. And to help those who suffer Corona Blue, the central and local governments are operating psychological counseling, which you're about to see. According to a recent survey of 1,031 adults aged between 20 and 65, some 40.7% said they experienced Corona Blue. which programs are currently being conducted by Suwon City for its citizens to overcome Corona Blue.
기본적으로 저희가 온라인 채널을 운영하면서 그 안에 이제 코로나 블루를 예방할 수 있는 정보들을 제공하고 있고요. 상담을 할 수가 있어요. 그래서 전화로 할 수도 있고 온라인 채팅으로도 할 수가 있어요. 그리고 자가격리자 같은 경우는 오픈 채팅방이라고 이제 그분들이 좀 모여서 같이 소통할 수 있는 공간도 마련해 놨고요. 그리고 이제 행복 키트라고 해서 이 안에 이제 그 심리 지원에 관련돼서 도움을 줄 수 있는 도구들이 들어 있습니다.
This is the happiness kit that is designed to provide psychological support to self-isolators. Items inside the kit would help them overcome depression and anxiety and rather feel much more positive. And let's see what's inside here. So there are a total of 4 items inside the pouch. And this is a bracelet. It reads Pulsera Positivo, which in Spanish means positive bracelet. And this is a journal where you can write down all your bad thoughts to deal with depression. The center said it has delivered over 2,000 kits so far, and it plans to deliver another 2,000 in the near future. For self-isolators, the center also launched an open chat. What are some problems that they are experiencing?
자가격리자들이 가장 힘들어하는 부분 중에 하나가 고립감이에요. 고립감으로 인한 외로움. 그리고 신체적인 증상 중에서 가장 많이 나타나는 것 중에 하나가 불면이에요. 그 사이클이 많이 깨지거든요. 그래서 이제 그 두 가지 측면에서 가장 힘들어하시는.
This welfare center runs several programs, including support program for self-isolators and psychological counseling for those who suffer Corona Blue. It also offers mental screening and counseling program using this ESI. The ESI test is designed to manage job burnout and stress of each worker. To see how it works, I took the test.
어떤 스트레스 상황이 왔을 때 뭐가 내가 이게 이해가 되지 않으면 화가 나는 분노하는 감정이 있을 수 있겠어요.
I could check my stress level through taking the ESI test. Then what can we do to overcome Corona Blue in our daily lives?
이제 밖에서 30분 이상만 걸으시면 돼요. 햇빛 받으시면서. 네, 그게 첫 번째고요. 하지 못하는 것들에 대해서 갈망하기보다는 오히려 할 수 있는 것들을 좀 찾아보는 게 되게 중요해요.
You also can experience depression, anxiety, and stress caused by COVID-19 anytime, anywhere. So if you're experiencing one of those, why don't you utilize the free counseling program? Also, please be consistent with your daily routine so that you can stay healthy both physically and mentally. This has been 신세벽.
It's time now for the regular briefing on COVID-19 here in Korea for this Monday afternoon. But before we tune into that, here are a few reminders. Now, starting from tomorrow, that would be the 1st of December, the Greater Seoul area, which is already under level 2 social distancing, will witness a few new restrictions in place until the 7th of December. In fact, let's take a look at the toughened measures on facilities and activities in the metropolitan region amid concerns over aerosol transmissions. Saunas and indoor sports facilities that offer high-intensity workouts will be banned. Now, these include boxing, aerobics, and other similar vigorous activities. Also, singing lessons, as well as those for wind instruments, are forbidden, with exceptions for those preparing for next year's college entrance. All apartment amenities, including fitness centers, cafes, and libraries, will be closed from tomorrow. Separately, authorities have called for the cancellation of all end-of-year parties and events at hotels and other such venues. Now, members of the public are also being asked to refrain from social gatherings of more than 10 people. Up on the screen now are the rest of the guidelines under level 2. Gatherings of more than 100 people are banned. Now, such large-scale gatherings include weddings and funerals. Also, 1/3 of all public servants and workers at public entities have to work from home. Private firms are being advised to do the same, but if that is not possible, they are being asked to ensure safe distancing among workers within the office. Civil servants have also been asked to refrain from social gatherings, and should they choose to ignore this advice and then be infected with COVID-19, they will reportedly face consequences. Sports events are limiting their audience capacity to 10%. Regular religious sermons face a 20% attendance ceiling, while small gatherings for choir practice, Bible study and meal sharing are banned. In the academic arena, kindergartens, primary and middle schools face a 1/3 attendance limit, but at high schools, the ceiling is at 2/3. Quite a number of schools nationwide, however, are opting to close their compounds and adopt remote learning. Meanwhile, high-risk facilities, including clubs and bars, have suspended their operations, while restaurants are allowed to accommodate in-house diners until 9 in the evening, and after that, they can only offer takeout and delivery services. Coffee shops, meanwhile, can only do the latter, meaning takeout and delivery services. Cafes located within residential complexes in the Greater Seoul area, however, will not be able to operate starting tomorrow. Indoor sports facilities such as gyms are to close doors at 9 in the evening, but again, those within apartment complexes here in the metropolitan region cannot open doors from tomorrow. That would be the 1st of December. Also, all facilities hosting high-intensity sports will see a ban on such programs. Meanwhile, public facilities such as libraries and museums need to abide by an admissions cap of 30%. Cycling and horse racing tracks are closed. Also, facilities found violating any of the measures under Level 2 will not only face fines, but also closures of business. Now, recent data shows more than half of Korea's infections have occurred at places of worship and workplaces, followed by those at various healthcare centres. Accordingly, authorities are urging for public support in efforts to better contain outbreaks at these venues and to discourage all forms of non-essential social gatherings. Right on the screen right now, we have today's numbers. That will be the numbers for Korea for this Monday. We have a total of 438 infections on this Monday, raising our total number of infections of COVID-19 to 34,201. We have 3 losses of lives today, raising our death toll to 526. We have more than 6,000 people in quarantine currently being treated for COVID-19, while 27,653 have fully recovered. Now, we are still waiting for the briefing to start, and perhaps while we do, we can have a few words, or exchange a few words, that is, with our Kwon regarding what is expected to be announced perhaps on this Monday, Soha, by our health authorities.
Well, because it is Monday, we are likely to hear of the weekly assessment of the coronavirus situation, and probably we will have a daily rise, an average in the daily cases, because we have been seeing cases in the 500s last week for 3 straight days. Although we have been going down to the 400s on Sunday and also this Monday, that is, of course, due to the lower number of tests conducted over the weekend. In fact, I believe we had some around 7,000 less tests than last Friday, for instance. So we might even see higher numbers as the week progresses. Authorities have been also warning that if people do not abide by social distancing measures, the numbers could even rise to above 1,000. Of course, that is if people do not abide by the measures. And they should, especially because the government decided to keep the level in the metropolitan region at level 2, and that with consideration of economic woes that people could be facing. But as you mentioned just earlier, we do have these extra measures in addition to the level 2 measures, which include stricter measures at some high-risk facilities and even the banning of some of those, such as saunas, as well as indoor sports facilities. And these are, in fact, dubbed the so-called plus alpha or extra measures, because we do have a 5-tier system now, but it's not a level 2, also not really level 2.5. It's going to be not easy for citizens to really remember all of these measures, but they can be fined actually for not abiding by those. So businesses will have to study all of these measures beginning tomorrow, because this measure will be in effect for a week from December 1st to December 7th.
Right, and of course, this measure measures that you just mentioned also include a lot of activities regarding concerns, in response to concerns, that is, of aerosol transmissions.
Exactly.
So singing classes have been suspended, as well as those for wind instruments, lessons for wind instruments, unless, of course, you are a student preparing for the college entrance examination, that is.
Exactly.
And speaking of that, the examination will take place on Thursday, and we have a few measures in place for safety regarding that as well, right?
Yes, we have measures regarding that as well. Many cram schools have there have been infections related to cram schools, and also other facilities where students could be going to. So PC rooms or other high-risk facilities have implemented stricter measures. Of course, authorities are doing all they can so that the students can take the test in a safe environment, and that also goes for students who actually have symptoms of COVID-19 and even those who are infected of the virus, because in Korea this test is really important, which is also why authorities have been again raising social distancing measures in the span of 2 weeks. So we have just recently been at 1.5 levels here in the metropolitan region, but just days after we went to level 2. That is not only for the safety for the students, but of course the entire nation.
Right, and speaking of these students, for those who display symptoms on the day of the test, do remember they are separate centers where they can take their test. They will not be forced not to take it, of course. Measures have been kept in place to ensure that these students who display symptoms on the day of the test, that will be on Thursday, is it?
Yes.
So they will be able to take the test as well. Now, we are still waiting for the briefing to commence, and perhaps while we do, we can take a look again at the toughened measures on facilities and activities here in the metropolitan region to start from the 1st of December. That would be tomorrow, for exactly a week until the 7th of December. Now, the measures include saunas and indoor sports facilities that offer high-intensity workouts will be banned. These include boxing, aerobics, and other similar activities, vigorous activities, that is. Now, I do believe that the briefing is about to start. We'll come back to you afterwards.
Let us now begin our regular briefing for the COVID-19 response here in South Korea. As of November 30th, Monday, we have a total of 414 new local infections and 24 new imported cases. The total caseload now stands at 34,201. Currently, we have 6,022 people in quarantine undergoing treatment, and there are 76 patients with severe or critical conditions. We had 3 additional fatalities. The accumulated death toll now stands at 526. And the fatality rate now stands at 1.54%. I extend my deepest condolences to the deceased and the members of the bereaved families. And let us now go through the updates of our major domestic infections by region, starting from Seoul City. In relation to the aerobic class in Gangseogu district, we have 13 additional cases being confirmed. A total of 189 have been confirmed to date. And also we have a linkage to a nursing hospital, and this includes 21 people. And in relation to Incheon City, Yeonsu-gu district, we have the nightclub bar, and we have 4 additional cases being confirmed, and we have 53 cases to date. And in Chungbuk region, in relation to a kimchi making gathering in Daecheon City, we also have 15 additional cases, making the total to 55. And we have seen that this kimchi making gathering has been spreading the virus to families and office spaces, as well as also to daycare centers, and now amounting to 55 people. And in relation to Gyeongsan, in relation to a music university there, we also have additional cases, and a total of 25 people have been confirmed to date. And here we say that index case has spread the virus to the university as well as high schools in the region. And in Busan City, in relation to a religious facility in Yeonjae-gu district, we have a total of 15 cases being confirmed. And also in relation to Busan and Ulsan cities' Changgu lessons, currently we have 146 cases being confirmed to date. And in Gyeongnam region, in Jinju City, in relation to a group training, we have 6 additional cases, raising the total to 72. And today we have released the statistics of the COVID-19 cases, and there were some amendments and revisions. So here are some reasons behind that. And in relation to the Gyeongnam area, we have been carrying out, we have seen some errors in relation to the diagnostic tests there, and we have seen that we had errors for 3 days starting from November 17th, and they were also among the testings carried out for sailors from overseas. And our agency conducted the testings again, and we also have tested that 61 imported cases have tested negative, and we have deducted these 61 cases from the total imported cases. And we also have seen the Busan quarantine office that has also seen some errors, and we have suspended all of the testings, and we are reviewing the reasons behind these errors, and we will be vowing to enhance our quality of the testings going forward. And next, let us go through the risk factors for the past week. And average local daily cases for the past week now stands at 400, near 400, and this is an up by 144.5 cases from the past week, and we have seen 4 straight weeks of upward trend. And imported cases, we have 24.4 cases, and we believe that this is in line with the global pandemic as well. And compared to the past week, we have seen a slight decline in the number of imported cases. And looking at the sources of infection, we have cluster infections standing at about 38.1%, and about 32% stemming from the contact with previous cases, and 18%, or about 561 cases, are also under investigation, and about 5.8% are imported cases, and about 3.8% are related to the nursing hospital. So this is a slight decline. And recently, nationwide, we are seeing the virus stemming from family gatherings, acquaintances meetings, as well as multi-use facilities, including saunas, as well as education facilities, including cram schools and other private academies, as well as religious institutions. And we also see some various venues of the spread of the virus, also including nursing hospitals and other health clinics. And as we near winter, we are seeing more people congregating indoors, and also we have many other risk factors such as the cold weather, which makes it easier for the virus to survive. And we also have large year-end gatherings, which we believe that could spread the virus even further nationwide. And in domestic cases, compared to the August and September, we have seen a large proportion of the cases that are under the age of 50, and those under the age of 50 now stand at over 76%. And for the past week, we had 19 fatalities, and their age group ranged 9 from the 80s, also 1 from their 50s as well, and 16 had underlying illnesses, and for the rest of the 3 people, we are conducting investigation. And the fatality rate for those over the age of 80 stands at about 13.8%, which is a slight decline from the 20%, and about 6.5% for the 70s, and also slightly lower for those in their 60s as well. And as of today, we are seeing that on a daily basis, we have about 293 cases in the metropolitan area, and also 30 cases in the Chungcheong area as well in the Honam area. And all of these counties and regions pass the threshold of a level 1.5 or even level 2. And to this end, starting from tomorrow, December 1st, we would like to intensify our quarantine measures for the metropolitan area until December 7th, and they include all the multi-use facilities that have higher risk infections, and also the activities that are mainly engaged by young people. And the toughened measures include the following. So the saunas and public bath will suspend their business operations, and also indoor sports facilities that accompany vigorous sporting events will also be suspend operations, and all of the music instrument classes, including the wind instrument as well as singing classes, will also be banned. And all of the facilities, multi-use facilities within the apartment complexes will be banned as well. And centering around the younger generations, in order to curb the further virus spread, we will also like to put a ban on all year-end gatherings that are hosted by accommodations, including party rooms, guest houses, as well as hotels. And we will also intensify our quarantine measures with pan-government efforts. And moreover, in the metropolitan area, all of the residents are advised to refrain from going to large gatherings that are participated by over 10 people. We are also strongly urging all of the people to refrain from such gatherings. And in the non-metropolitan area, we have upgraded the level to level 1.5, and this will also be carried out for the next week. And we will also, depending on the local governments, we will give them the discretion to elevate the standards. And together with this, we would also like to monitor the trends of the COVID-19 so that we will also continue to respond immediately if we see continued upward trend. And next, on the influenza virus, we have some updates. And for the 47th week analysis of the influenza virus, out of every 1,000 patients, we had about 3.2 cases of influenza virus being detected, and we are not seeing a rapid increase of the virus. And we also conducted sample testings that were carried out at hospitals, at 52 hospitals, and there were 0 cases of influenza virus, and most of them were rhinovirus, which also makes cold-like symptoms. And we also carried out the respiratory samples, and we have carried out about 2,700 samples, and there were 0 cases of detections of the influenza, and we say that the influenza outbreak is not yet in full-fledged. And however, we see that the virus spreads very fast among people after the late December until the early January. So we ask for you to get your flu shots if you haven't done so. And this week we have about 500,000 of people going to the Sunung testings, which is the college entrance exam. And this is why we have carried out 2 weeks of special quarantine measures, and we have asked the public to participate in this measure as well. And as we are seeing a nationwide outbreak, we are also seeing that these viruses are spreading through family members. So we ask you to also comply with quarantine measures until the day of Sunung. So please abide by these measures going forward. And the quarantine authorities will also make sure that we will grant a safe environment for the people who are taking the testings, as well as those who are isolated but who will be taking the test at isolated centers. And we also have additional announcements for the public. Starting from January, for the past 11 months or so, we have been responding to the COVID-19. There were many crises, but we believe that the largest crisis is this winter that we are experiencing now, because there are many silent spreaders within the community, and also the cold weather makes it easier for the virus to survive as well. So the risk factors is very high. However, we also see that many of the public are fatigued over these prolonged COVID-19 spread, and there are also burnout syndromes that are experienced by many medical staff members as well as local government authorities. However, if we fail to overcome the virus spread right now, we will put all of our past efforts and the hard-earned efforts of the past 11 months in vain. So once again, we would like to highlight that this winter is very important and crucial in overcoming the COVID-19 virus. The two are very important. Two factors are very important. So first being refraining from going to large gatherings, and also second, getting tested as soon as possible. We need to minimize physical contact with people, and this is the only way to cut off any chains of transmissions. So during the holiday season, we ask you to refrain from any gatherings aside from your family members. COVID-19 does not discriminate any people, and it can spread very easily among silent spreaders as well. So it is very important to take precautions as well. And we have recently seen that many COVID-19 infections stemmed from kimchi making gatherings, as well as many alumni meeting and social gatherings. And it can also spread at a very fast pace in these small group meetings. So during the holiday season, please also see that there are no more physical gatherings. There should be no more physical gatherings as well. And all of the Christmas events, religious events, should also be banned as well. So please switch to non-face-to-face means. And as for the people within the 20s and 30s, we ask you to participate in these measures as well. And second is the importance of fast and massive testings. And the rate of reproduction rate and infectivity rate actually stood above 2%. And this means that the virus could also be spreading very fast among the community. So if you show symptoms, especially after going to a large gathering, please get tested as soon as possible, especially if you show symptoms of loss of any smelling or any tasting as well. And also we have seen many high-risk facilities, especially the nursing hospitals and nursing homes. If you have symptoms, please get tested as soon as possible if you are working at these facilities. And if you also have some suspected patients within hospitals, please also guide them to get tested as soon as possible. We will also exert our full efforts. Thank you very much.
Right, that was Commissioner Chung Kyung with Monday's afternoon briefing. So what was the gist of her address?
She said something very important: minimize physical contact until the end of this year, because the current crisis is seen as the biggest crisis we've seen here in the country ever since the first outbreak 11 months ago. And that's also why we're seeing currently a daily average of 400 cases in the past week, which is up by 144. So nth transmissions is what we have to be careful right now, because infections are traced to a wide variety of places as well as among a variety of groups.
All right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
Right, elsewhere, France has begun easing its lockdown amid a drop in hospitalizations for COVID-19 infections. President Emmanuel Macron has claimed the worst of the second wave is over, and the current lockdown will be completely lifted by mid-December, with a curfew of 9 p.m. in place instead, if the daily tally falls to some 5,000. For more, I have Lisa Louise live on the line. Good to see you again, Lisa.
Good morning.
Lisa, I understand there's been a tangible decline in daily infections.
Well, absolutely. As you said, the people who get infected per day by COVID-19 has now gone below 10,000. It was at above 80,000 at one point at the peak of the epidemic about 3 weeks ago. We've also seen a fall in the number of people in intensive care because of COVID-19. That's now at about 3,800, 1,000 less than during the peak of the recent epidemic here in France. And 2 people now only contaminate 1 additional person with COVID-19, so that our value has actually gone down to 0.5. But as you said, we're not quite there yet. President Emmanuel Macron in a recent speech said that we needed to reach 5,000 new infections per day for the lockdown to be lifted completely.
Right, Lisa. So starting this past Saturday, meanwhile, shops have reopened. And while people still need a document to venture out, I understand they're now allowed to exercise for 3 hours outdoors instead of 1 hour. And they are allowed to travel further away from their homes. Do tell us more about this.
Yeah, absolutely. Until now, we were allowed out, as you said, for 1 hour per day and not 3 hours, and only 1 kilometer around our house. Now it's 20 kilometers. We are allowed to, go to work. We are allowed to go to the shops, which have opened on Saturday. But restaurants and bars remain closed, and also lots of sports facilities and places of worship have actually strict limitations as to the number of people they can take in.
I see. Lisa, is it true that French ski resorts will be closed until next year?
Well, partially so. So you're not allowed to use ski lifts. Those parts will be closed. Restaurants and bars will remain closed. However, people can go to the mountains, to stay at hotels there and go for a walk, for example, in the mountains. The government wants to help the people who work in these areas. Obviously, they're also providing financial support for, restaurant and bar owners, and also to seasonal workers. The government said that under certain conditions, people would then get 900 euros per month until early next year to help them get through this period. Now, this is obviously a slightly controversial decision, and Europe is not united when it comes to that. There are other countries such as Switzerland and Austria and Sweden who have decided to reopen ski resorts. And many people here in France, also in Germany, where ski resorts are supposed to stay partially closed, are now complaining that this is not really fair for them.
I see. Lisa, one final question before you go. On the vaccine front, vaccination in France may begin in late December or early January, I understand, but it will not be mandatory. Please tell us more about this.
Well, obviously, President Macron said that it wouldn't be mandatory, and he said that because he knows that many people here in France are very skeptical about that. Recent polls are showing that about 60% of the French don't want to get vaccinated, even if there is a vaccine on the market. And many people here are quite tired of the measures. They don't really trust the government very much because they feel that what the government has done so far has not always been very logical. So they also don't agree actually with all the measures that the government is taking, and the president doesn't want to force them to get vaccinated because he wants to show that he's not authoritarian in that respect.
I see. All right, Lisa, as always, thank you for making the time to share your thoughts with us live at this hour.
No, my pleasure.
수도권은 2단계 거리두기를 유지하되 집단 감염 발생 위험도가 높은 사우나와 한증막 시설은 운영을 금지합니다. 다음으로 비수도권의 거리두기를 1.5단계로 상향 조정합니다. 이러한 확산세를 지금 막지 못한다면 하루 1,000명까지 확진자가 늘어날 거라는 전문가들의 우려가 현실이 될 수도 있습니다.
Contrary to public expectations, authorities have maintained social distancing at level 2 for the metropolitan region and raised the level for other areas to level 1.5, effective as of tomorrow. That would be the 1st of December. Now, many had expected a more intensive intervention given the recent tallies on COVID-19, but officials have cited potential economic fallout as reason for their reservations. For more, I have Dr. David Kwak from Soonchunang University Hospital. Good to have you back, Dr. Kwak.
Good afternoon.
And I also have Professor Lee Hyun-ju from Seoul National University. Pleasure to have you with us, Professor Lee.
Thank you for having me here.
Right, Dr. Kwak, I'll start with you. What are your thoughts with regard to the government's latest decision to keep level 2 distancing in place here in the metropolitan region with toughened measures on quite a number of facilities?
Well, they're really keeping within the rule. When they set out to have 5 different levels of social distancing levels, by the book it says, well, if we were to go up to 2.5, we were supposed to have had weekly average of more than 400 to 500. We just haven't had that yet. We're very close to it, but it's just not up to par. So in a sense that we could say they're actually stepping ahead, trying to take control of very focal areas as in cases of bars and whatnot. So by the book, by their own regulations, we're not up to 2.5 yet. That being said, also the government has to be concerned of two different things at the same time right now. Get the economy going, but also at the same time mitigate the virus. I think really they're trying their best to do both at the same time. And it's really, from a medical doctor's position, I sort of feel it a little bit lacking in a sense that we probably could do a little more. We could have people more staying at home and self-quarantining and whatnot, and also keep the measures very high, very toughening it up. But also at the same time, there might also be secondary and tertiary effects stemming from economic status. So I understand where the government is coming from, and that's exactly where we are, trying to manage two different things at once.
Right, they are seeking a kind of balance, of course. Professor Lee, it's been a week since level 2 social distancing was put in place here in the metropolitan region. When are we poised to see the impact of these toughened measures, do you suppose?
Yes. Considering the incubation period of the COVID-19, which is on average 5 to 7 days and can be as long as 14 days, one could expect to see the actual impact of the difference in social distancing measures within 1 to 2 weeks after implementation. As we are in day 6 currently, hopefully we will be able to see a slow and gradual decrease in the coming week. However, these will greatly depend on the compliance on each individual in the society. Small non-compliances can lead to great outbreaks also. So we will have to ask each other to comply with the measures, and we'll have to take a good eye on the number of cases.
Right. Dr. Kwak, I suppose this week's COVID-19 infection numbers will be a reflection of how well social distancing was abided by this past weekend. Would you agree?
Well, partially, yes. I would think that the fact that we just started seeing 400s and 500s in the national tally, it is going to have had an effect in so that people are a little bit more scared now. Back a couple of weeks ago, we were having increase in the number because people, not just because people were not abiding by the rules, but more so because people were rather being complacent. So even if there was measures that were being put on by the government, people were really taking very lightly on it. Now the scheme has changed. People would be scared. So over the weekend, I noticed people around me, they were really hesitant to even go out a meeting that they were already scheduled for. So I'm hoping to see that the numbers would drop down to quite low of a number this week.
Right. Professor Lee, there had been concerns about a potential twindemic earlier on of the seasonal flu and COVID-19. What is the current situation with regard to the flu?
Yes. According to the Influenza Sentinel Surveillance System, just last week we have seen 3.2 cases per 1,000 patient visits in the outpatient office. This is actually 1/3 to 1/4 of what we have been seeing in the past few years. So we can say that efforts to control COVID-19 have definitely also have been showing a great impact on other respiratory viruses, including influenza. However, if we do experience a surge in COVID-19, there will definitely also be an increase in influenza and other respiratory viruses. So I think for this winter, compliance for facial masks, hand hygiene, respiratory etiquette, and along with appropriate ventilation in closed areas will be very important to control both of these viruses.
Right. Dr. Kwak, as you mentioned earlier, while level 2 social distancing has been maintained, new restrictions have been placed on a few high-risk facilities. Now, these include saunas or indoor sports facilities that host high-intensity sports, as well as singing classes and lessons on wind instruments. So some medical experts have claimed that such address concerns with regard to aerosol transmissions. Do you agree?
Well, yes, I do actually agree. And as Dr. Lee already mentioned here, that the respiratory diseases that are that we need to really mitigate at this time, not just the COVID-19, but also talking about influenza here. It really spreads in a confined space where people come together and not either they're talking loudly or they're singing or they're just breathing heavily. In those situations, our aerosols will just remain in the air for another person to come in and breathe in. So that being said, as Dr. Lee already mentioned, it's very direly important that we try to ventilate any confined spaces that we might have, including that of the churches or any other restaurants, or even when we're facing the yearly suneng that we're facing, I would hope that they would ventilate every moment possible, so to let the fresh air in and also to let the bad air out. So respiratory symptoms, respiratory transmission of the virus is one biggest thing we're suspecting right now. But also, at the same time, we should also be careful not to touch the surfaces where aerosols might have touched. So that's another important factor that we have to take into consideration here.
So both ventilation and disinfection is very important then?
Yes.
Professor Lee, compared to findings in the early stages of the pandemic, what is the latest with regard to infections among children?
Yes. Actually, we are seeing an increase in proportion of cases in Korea. This is not only in Korea, but also in many other countries, including the US. In Korea, initially, early in the pandemic, about 5% of all cases were children under 19 years of age. In the midsummer, it slightly increased to about 7%. And currently, we are seeing around 10% of all cases. Although there is an increase in cases of children, luckily we are not seeing an increase in mortality or morbidity. Cases are generally mild, and there are no cases with mortality in any case under 29 years of age. So although there is an increase in the proportion, luckily we are not seeing an increase in severity.
Right, and hopefully that will be the case in the future as well.
Yes, I hope so too.
Right, Professor Lee, thank you very much for your thoughts. And Dr. Gwak, as always, thank you for being with us today.
Thank you.
Right, and that brings us to the end of Monday's coverage of COVID-19. Now we'll be back tomorrow with more on the pandemic. In the meantime, do take care and do seek to abide by social distancing measures. Thank you for watching.